I'm Chris Keebler, Communications Director here at TrueNorth Community Services. Welcome to the third episode of Good Happens Here, the TrueNorth podcast where we take a deep dive into topics that we hope you'll care as much about as we do. As a reminder, the audio-only version of our podcasts are available pretty much wherever you get your podcasts on pretty much all major podcast host sites, but only for 90 days after they initially post. After 90 days, they're only available in the video version on the TrueNorth YouTube channel. There's a Good Happens Here playlist with all of the episodes available there. So if you haven't listened to either of the first two episodes and you really prefer the audio-only versions, get on it soon. This episode is brought to you in part by great local restaurant and event space, the River Stop Cafe. From humble beginnings as a 15-seat coffee house, River Stop has been an ever-evolving, independently owned local small business with its heart rooted in the community. Located in the historic old downtown area of Newaygo, River Stop is a great place to get breakfast, lunch, or dinner. They even serve Michigan microbrews, good wine, and fresh cocktails. River Stop, cafe, bar, eatery, gathering space. Today we'll be talking about social prescribing. Last month we took a deep dive into social isolation, which simply put is the objective lack of social contact and relationships. If that's the problem, social prescribing is definitely one of the solutions. Social prescribing is a healthcare approach where doctors, nurses, and other primary care professionals refer patients to local, non-clinical community services such as arts, exercise, or volunteering opportunities to improve health and well-being. It addresses the root causes of poor health, such as loneliness, debt, or isolation, by focusing on holistic, social, and emotional needs rather than just medical symptoms. Joining me today is TrueNorth's Community Connections and Cultural Enrichment Coordinator, Riley Knight. Welcome to the podcast, Riley.
Hi.
All right. So I gave a pretty good synopsis of what social prescribing is before you came into the room. But as I understand it, the approach was pioneered in the UK, and they're kind of like the experts on it. As someone who's doing this locally, though, on the front lines, how would you describe it to someone who has no idea what it is?
I would describe it as building social circles and a sense of community. We know that our older adult population needs social prescribing, but we also know that many of our kids in Newaygo County need social prescribing as well.
Interesting. Okay. And correct me if I'm wrong, but when we first started this, did we not send people to London?
Yes.
Who did we send them to? What organization were we? Do you know?
I do not know
Okay.
the specific organization, but there is a huge coalition,
Okay.
and they went over to London, and they spent 3 days with this coalition to learn everything about it. And over in the UK, it is top down, so the government does run the social prescribing program over there,
Okay.
whereas here in the United States, it's more just like an organization like us funding it and going about it in that way.
Okay. They were in London for just a few days.
Yeah.
It's a government-funded social prescribing, but they learned how they do it. How long has it been happening there? Do you know?
Multiple years.
Okay, but it's really new here.
Yes,
Okay.
like very recent. We're one of the first ones to work in social prescribing in the United States.
Okay. So it sounds like this is really taking a holistic approach to dealing with what are potentially very adverse health effects of social isolation. We covered most of them in last month's podcast when we talked to your mom.
Yes.
But just as a refresher, how serious are the health risks associated with social isolation?
They're very serious. So social isolation can increase your risk of dementia by 50%.
Oh boy.
It can also increase your risk of heart disease by 29% and your risk of stroke by 32%.
So, yeah, those are substantial numbers. And your mom threw out a stat last month. It just blew my mind. It's equivalent to smoking 15 cigarettes a day, not a week, a day. That's like just nonstop smoking. When you're socially isolated, you might as well just be smoking cigarettes all day long by yourself. That's the negative health effect equivalency, yeah.
And already 1 in 4 of adults in America are socially isolated.
Already.
Yeah.
Okay, so are there a lot of organizations doing this here in the U.S.? And I guess more specifically, is anyone else really doing it with rural populations?
We are one of a handful of organizations that are doing it.
At all, regardless, anywhere.
Yeah, there's a Social Prescribing USA page, and you look at it and there's a map, and there's about 20 organizations in the United States doing it, but all of them fall around major cities.
So we're probably, in typical TrueNorth fashion, we're doing something completely out of the box.
Yeah.
And we may be the only ones doing it in the country.
When we wrote this grant, it was for an innovation, and what we're doing is really an innovation.
Okay. Maybe talk briefly, like what makes, it's still kind of new, but what's different about doing it in a rural setting, or what are some of the challenges of doing it in a rural setting?
Oh, there's so many different challenges with a rural setting. In an urban setting, it's very easy to gather in community places because they're closer together. Here in Newaygo County, we're so spread apart, and there's parts of the county that aren't accessible, and transportation is a huge issue. Technology, we don't have internet throughout.
Not everyone has connected.
Yeah.
Right, yeah. My wife was a teacher in the county, and at one point she gave me the stats on how big our county is. Like from one corner, the square feet or the square miles, it's a huge county.
Yeah.
And it can take you well over 2 hours to drive from the corner to the other corner. So it's spread out. And if you're in Grand Rapids, they can send you 2 blocks down to this organization to go take a class and whatever else. And here you might be 2 hours away from something.
I think we did a comparison of when we were writing for this grant of Kent County having over 200 resources for older adults, and Newaygo County just having a few.
For you, right. Okay, so it's called social prescribing, and I think, which makes it sound like people are getting a prescription from a doctor to, go do social things. That's not literally how it works, though, right? So can you explain how the partnerships work with local healthcare providers and other organizations, and how the whole thing actually works?
Yeah, so we don't just work with healthcare providers because they aren't the only ones who see lonely individuals or older adults. We work with our frontline workers, we work with our hairdressers, we work with our pharmacists also. One of the pharmacies here in Newaygo County is actually our biggest referral source. Social workers even, Newaygo, the city of Newaygo is luckily has a social worker, and she refers people she sees all the time to us.
So I'll call it the UK model, the original model. That's strictly coming from healthcare professionals, right? So we're deviating a little bit that way, but we are working with healthcare professionals also. But in a place like Newaygo County,
you kind of have to prove, or not necessarily prove, but show the importance of this so that we can have more healthcare professionals
get the buy-in.
Yes, and then see the purpose of social prescribing.
Yeah, some of these stats and some of these figures and whatever else are still kind of emerging. So doctors are just kind of, and they're pretty aware of this, of trends and things, but they're just kind of becoming aware of the health risk associated. So as they're becoming aware, more likely to get involved. But it's not like somebody shows up at their doctor and their doctor says, "Oh, you know what you need? I'm going to write you a prescription to go take a drumming class." That's not social prescribing.
No.
But they might refer them. You should call TrueNorth because I know they have this, or a social worker might, or a hairdresser, whoever is just dealing with people, especially the aging population. Okay. So. Yeah, it can be a little misleading when we call it social prescribing.
Yeah, it's not really a prescription. It's more of a conversation.
All right, so let's talk about our Engage program. How does it work? Who can participate? Yada, yada.
So we ask the question when you come in. The first thing we're going to ask you is what matters to you and not what's wrong with you.
not what's the matter with you. It's what matters to you. Okay.
So that's how we start. And, it's just really a friendly conversation, much like me and you are having right now, Chris, and it might be over a cup of coffee, over a cookie, just really finding out what you want to do, how you can expand your social circles, and how we can help you walk that path. Okay. And we might walk that path with you hand in hand for the first few visits here and until you're comfortable being here or at another organization that offers programming.
We should verify or talk about that a bit. We are working closely with a lot of other organizations who also offer programming that this population might benefit from. So it's not just referring people to our programs.
Nope.
There are many other places that people can get involved and do stuff. I'm involved with a local community theater troupe. We might run into somebody that says, you know what, I used to do theater when I was a kid. And you go, you know what? Call Lionheart.
Yep.
Because they need people to work backstage or on stage or whatever else, for example.
Yep. One township at a time is another one. They have activities going throughout many different townships at a time. So often if we don't have something going in that township, we'll hit up them for resources out in that area.
Just a reminder, today's podcast is sponsored by Riverstop Cafe. I mentioned earlier, they serve Michigan microbrews, wine, and cocktails, but let's not forget their famous and delicious coffees, espressos, and lattes. It really is a great place to stop in for a coffee, a great meal, a drink, or an event space. It's got a really cool atmosphere in a really cool building, and everything on the menu is just great. I literally don't think I've ever had a bad meal there. Riverstop Cafe, check them out. So what are the specific differences between our Engage program, and it's Engage, all caps with an exclamation
Yes.
point, Engage and Community Connections, which we talked about in our last episode?
So Community Connections is more of our programming piece. It's our day-to-day in-hand programming, where Engage is the connector piece.
Okay.
We built Community Connections and realized we were hitting a certain population, but we were missing the larger population.
Right. The ones who are really, everyone, there's the isolated people, then there's the really isolated.
Yes.
How do we get them?
Yep.
Right.
So then we started Engage, and we are working towards, we might have to go down a 2-track to have a cup of coffee with somebody to understand what they need.
Right. So it's really about having staff or staff persons who that's their job is to seek these people out, to make the connections with the hairdressers, with the doctor's office, with whoever, and seek out and find the people, and then they're the ones that build the relationships with them and say, hey, here are some places that you might want to go check out.
Yeah.
So it's not just about okay, I get it. Community Connections is programming, and program specific. Engage is more of the connector.
Yeah.
Okay. You said it better. I just said the same thing you said. Maybe I'll cut that all out. What does the intake look like when somebody first makes a connection? What do we call our people? Our Engage? We call them connectors.
Yeah. Well, we call our staff that work for us that do the intake process. We call them link workers.
Okay. So when a link worker hooks up with somebody who might need this service, what does the intake look like?
It can be, if they feel comfortable, they can come into TrueNorth. If they don't feel comfortable, we can meet them outside of TrueNorth at a coffee shop.
Do we go to people's homes?
We do go to people's homes. It's really just a conversation. We talk. We gather information from the intake process, but it's not a interview by any sort.
Right.
It is, hey, you get to know me and I'll get to know you, and then we come together and we figure out what's going to work for both.
Sounds pretty low key.
Yeah, it's very comfortable, very relaxed.
Much less than a doctor visit.
Oh, yeah.
Okay.
Yeah.
And how does it work? Is it any different when we get a referral? I mean, that's just how we find the person.
So
right?
So you can self-refer yourself as well. So if you yourself know you're socially isolated, but you don't necessarily want to make that initial phone call, you can refer yourself. You can do it on our website. We have QR codes all over the community, or you can just call us here, and we will have a friendly conversation, set up a time, and then we move throughout the process that way.
Okay. So we've been doing this for at least a year. Are we into our second year of doing it?
No, we just started. Well, we officially launched. We had a pilot program for 6 months. We officially launched the program in September.
Okay, so we're still relatively new.
Yes.
What kind of results are we already seeing with the people that we've got involved through Engage?
I remember our first person we did an intake with. And now that person attends programming at TrueNorth, I would say 3 to 4 days a week. She had lost her husband, and through the process, we learned that she had never even put gas in her own car. So we have...
Yeah, and I don't want to just like laugh at that, but that's just there's a reality, especially with an older population, may never have used the checkbook, may never have had to put gas in the car themselves or whatever,
Yep. And
conversely, have never had to cook. My wife always cooked. Like, for example, how do I cook now? I have a friend who recently lost his wife, and he doesn't cook, so he's eating a lot of garbage. So
through that process, we learned this, and we found out that she's only comfortable going to one gas station, and that's all she'll go to. So through this process, we're helping her learn how to put gas in her car at other gas stations, so she's comfortable and she can go out more and not have to worry about, I have to be around this gas station.
This case you're specifically talking about, how did we first connect up with them? Was this person referred by a doctor or by somebody else, or do you know?
She was referred by her daughter.
Okay.
Yep. And that's something we're seeing quite often is the older adults, children referring them because they know they can't always be around.
Sure.
They have busy lives, but they also don't want their loved one to stay at home.
Sure. Also, it could be that the children of our aging population may not even live local, so they're talking to their mother or father on the phone, and they're realizing they're just sitting home all day. So, and that's the cool thing about podcasts, anyone can watch this. So you could be watching this in California or in New York, but you know that your mother or grandmother or whoever, or grandfather or father live in Newaygo County and they're alone. Give us a call, right?
Send them to us.
Okay.
We'll help them.
So this is a very specific funding source that we got to pay for this program. We're going to talk a little bit about the Enterprise Foundation and the Tomei grant.
Yes.
They're our primary funders. Are they our sole funder or primary?
So for the Engage program, they are our sole funder.
Okay.
So Enterprise is a very large foundation, and then...
And I asked, it's got nothing to do with Enterprise Rent-A-Car.
No,
okay,
and not
so it's a different organization totally.
They do a lot of housing work, and then they do it in Maryland, and they do it here in Michigan. But specifically, our funding source came from the Tomei Aging Well Innovation. And it was a very competitive grant to receive.
Yeah.
We went through multiple steps and processes, and it was an experience to write and work on, for sure.
And that funded our initial pilot program.
Yes.
Okay, so if anyone's watching or listening and they think social prescribing might be the answer for them and someone that they know and love, what is the first step?
Just call us. That's all you need to do. Call us and you ask for the Engage team, and one of us will call. Okay. And we will set up a time to meet with you.
We'll put the numbers up on the screen for people watching on YouTube. But people who are listening, it's 231-924-0641. I'm including the area code because there might be somebody calling who's listening who's not local. 231-924-0641. That'll get you to the front desk and just ask for someone with Engage.
Yeah.
And that's the first step. So is there anything else we need to cover or that you want to say about social prescribing or our Engage program? A question I didn't ask you?
No. The only thing I can say is we know it's scary to start new things, but all it takes is a phone call, and we're a friendly face waiting to talk to you guys.
Okay. Well, thank you for watching and or listening to our third episode. If social prescribing sounds like something you might want to get involved with, or you work in the healthcare field and would like information on how to refer patients to the Engage program, and if you work in any field where you're working with aged people and you want to know how to refer people, we encourage you to reach out to Riley or anybody else in the Engage department. I'm going to put Riley's contact information on screen, but for those of you who are listening, you can call her here at TrueNorth at 231-924-0641. Her extension is 178, or email at ournight, RKNIGHT at TrueNorth Services, TrueNorthServices.org, O-R-G. You might also visit our website at www.truenorthservices.org. If Riley's not available, you can just ask for anyone in the Engage program. We want to thank Stephen Thwaites, who is our behind-the-scenes audio engineer for these podcasts, and he's been working hard to make sure these work properly. We had some tech issues today, but Speaking of tech issues. Wow. Well, the good news is it's going to be one of our shorter podcasts. That's okay. I'll put better sticky stuff on it next time. Thank you, Stephen, regardless. If your business or organization or even you personally would like to sponsor any future episodes of Good Happens Here, of Good Happens Here, please reach out to me here at True North. 231-924-0641, extension 113. Or you can email me at ckeebler@truenorthservices.org. That's CKUEBLER at truenorthservices.org. That's it. Well, that was interesting. That's what makes these things fun.
Yes.
Thanks for being here, Riley, with me tonight. Thank you to Riverstop Cafe for sponsoring our third episode. And to all of you, thank you for helping make good happen here.